Turf toe occurs when the ligaments around the joint of the big toe become sprained. Sports that require running and jumping on artificial surfaces often cause turf toe. Rather than arising from overuse, this condition often occurs from a specific instant of impact. On the bottom of the foot, two small bones called sesamoids lay within the tendon responsible for movement of the big toe and supply the toe with leverage and support. The sesamoids also act as shock absorbers while walking, running, and jumping. If subjected to a sudden impact, the ligaments around the sesamoids may hyperextend and sprain, causing turf toe. The most common symptoms associated with turf toe include pain, swelling of the toe, and decreased mobility of the toe joint. To diagnose turf toe, a foot and ankle specialist will start by performing a physical exam and will most likely order x-rays to determine whether or not the toe has a fracture or other injuries. To treat turf toe, physicians typically use conservative treatments. The usual combination of rest, ice, compression, and elevation combined with anti-inflammatory medication typically allows turf toe to heal. To protect the toe, the doctor may suggest the use of a walking boot or cast to hold the joint steady. Patients should feel improvement in 2 to 3 weeks. In severe cases, the doctor may need to resort to surgical intervention followed by a physical therapy regimen.